onto the sterile sleeve. So it takes two people. You have to have one person that's sterile, which you will have. You'll have the OR tech, and then you'll have yourself. Okay, so they might need help with local anesthesia. So I'm going to pick up my thing. I'm going to show the doctor, and I'm going to face the medication and the expiration date. The medication and the expiration date. Okay? So I don't, and you hold it eye level. Okay? As I'm doing that, as I'm looking at it, I'm also saying, okay, sodium chloride expires 9/10/20. I'm going to say sodium chloride 9/10/20. Okay, he's going to okay it, and then I'm going to take the cap off of it. I'm going to put an alcohol wipe on there, so because just in case my thumb touched the rubber stopper. And he's going to have the syringe, and I'm going to hold it like this, so that way I'm steady and the doctor's steady. Okay, if you hold it like this, look what happens. You're going to have that little bit of motion, and when he puts the needle in there, your hand's going to do this, because it's hard to put that needle in that little stopper. Okay, so kind of brace yourself. So that way, when he puts it down, you have the leverage to kind of push against the resistance that he's going to feel. Okay? Because what they do is they take the syringe and they put as much air in it as they're going to want to draw out. So they're going to push that air into the syringe. Okay? And then that way, their syringe will automatically fill up with the amount of liquid that they need. Okay. When you open a syringe or any type of dressing, let's just say this is my dressing. Okay, this is my 2x, let's say 8x11s, big pads. It's going to have an area, and I'm going to open it like this. The doctor grabs it. Or I'm going to open it like this, so it falls onto the tray. Okay? I don't want to open it like this. Why? Because I'm over the sterile field. Okay? But if I open it like this, I'm at the edge of the sterile field. Okay, and it takes practice, because this is what we want to do. But you need to open it like this. Okay? And then you just drop it onto the sterile field. Like Band-Aids. I hate Band-Aids. When we open a Band-Aid, don't we kind of go like that? Okay. I don't. I usually tear mine in half. And then I just pop off the things. Okay, anytime you have a sharp, you put it in a sharps container. Like the women's bathroom just installed a sharps container. Okay? Once you drop it in there, you can't ever get it back out. You do not recap your needles. Do not recap your needles.
But do the lids go in there too?
Everything. Why?
So that nobody recycle.
Yeah. I'm not gonna want, if my recycle's over there, I'm gonna be real careful walking across the room with a sharp. Because what if someone comes around like this and you stab it? Okay? So I'm not going to go to one place and then another place. I'm just going to go to one place. Okay? If you have a bloody towel or sheet, or if it's disposable, you just put it in a red bag, a biohazard trash. Every room has them, okay? If you have a bloody sheet, which you will have, you put that in a red bag, and so housekeeping knows that this is a biohazard sheet and towel. Okay, I'm not gonna put bloody linen in with regular linen. I'm gonna bag it by itself, because I wanna protect my workers that do the linen, okay? So biohazard containers are going to be red containers with red bags, okay? They will have a symbol on them, a danger signal. Yeah, it looks like a radiation biohazard. So when you go to a surgical suite, just like the MRI suite, you have different zones, okay? Zone 1 is unrestricted. This is where you're going to clean your machine, is in zone 1. Okay? Then you're going to go in zone 1, you're going to go and put in on your surgical clothes. They will issue those clothes to you. Okay? You leave your clothes in the locker room. Okay? And then you'll have to put on your clothes. They'll give you a mask. They'll give you a hairdressing. They'll give you booties. And now you're ready to go into zone 3. The zone 3 is where it's in the OR suite, but you don't go in and out of that suite unless you're released. You're not going to take an image and then go sit out in the lobby and then come back. Once you're in there, you stay in there until you're released. Because your name, you're going to go to the charge nurse and say, Georgette Shepherd ultrasound. So that way she documents who came into that room. That's twofold. So say they got in there and the patient had some type of a highly contagious disease. All I had to do was breathe the air. Okay? They'll know who to come. So that way I can get the proper medical treatment that I need. The other way, something happens in the OR, they know who to come for. Okay? Say my case goes to court. Okay? They can call my name to testify on what happened in the OR. Does that make sense? Okay. Because my name is part of the medical records. Yes.
Are we gonna do all this you're saying in
Yes.
We're gonna get the practice
Yeah.
in there.
Yeah. Mm-hmm. Mm-hmm. But the OR is very, very seldom. But you're going to be in IR, interventional radiology. So you'll be responsible for setting up the trays, having everything ready for the doctor. Okay. Typically, we're the ones that's not sterile, but we're involved with the invasive procedure. The different procedures that we do a paracentesis. A para is where they put a needle into my peritoneum. Remember my Ziploc bag? They put a needle into that Ziploc bag under ultrasound guidance. It's attached to a long needle. That long needle is attached to a vacuum bag, a vacuum bottle, and they draw excess fluid out of my body. People that are in liver failure tend to build up ascites. Okay? A thoracentesis. A thoracentesis is when they usually sit the patient up. They put it on a bedside table and the patient is sitting up as much as they can. You find the fluid and they draw a needle with the same way. Depending on the fluid, it could just be a syringe or it could be a vacuum.
This is, the patient. I think I heard you say that this is the. I don't know. You do it.
Yeah. Yeah, we assist the doctor doing it to the patient.
Okay. Can we do that to us before we go in there?
Oh, no. Okay. Okay, so we talked about thora, we talked about para, amniocentesis. You'll see that as part of maternal fetal medicine. Again, they have a tray that you'll be observing. You'll be finding the fluid, and then they'll go in there and they'll drain some fluid, 2 different kinds. You could have therapeutic, where they're wanting to do a chromosomal study on the baby, or it could be therapeutic, where she has too much fluid. Okay, and too much fluid is called polyhydramnios. Okay, either way, it's our job to clean the machine and make it as clean as we can, because we don't want any microbes to be transferred to an unborn baby. Okay? Gowns, we're not probably gonna be practicing gowns. These are gonna be some of the people that are going to be in the OR suite with you. It talks about how you have to clean your machine before you go in. Oh, that's it? That's it?
Yes.
Okay, it's a short chapter.